One 2-year study by the Boston Housing Authority at the Mary Ellen McCormick neighborhood found a 47% reduction rate in asthma symptoms, asthma attacks, ER visits, school absences when tenants moved out of older apartments into newly renovated units. This reality is no clearer than with the story of a constituent of mine, Angelo, who first came to the Boston Medical Center Grow Clinic at 8 months old, but was the size of a 4-month-old. He and his mom were living in an overcrowded apartment, sleeping in the living room with a leaking ceiling, infestations of mice and cockroaches, among other things. He developed allergies and was so weak he could not raise his head up. Since then, as a result of moving into quality public housing, he has now started to thrive, to gain weight, and hit the necessary developmental milestones to enroll in daycare. Ms. Yentel, do you agree that housing is a critical determinant of health?
Absolutely, and if I could add, I would say I think you raised such an important point, not only for the individual costs to children and to families, but to the federal government through inaction. So we're talking a lot about what are the benefits of a major investment and infusion of funds to repair public housing and build more. Inaction is expensive. We're paying for housing instability and homelessness one way or another, and as you raised, we're paying for it through increased health costs. When people are affordably housed, their visits to primary care physicians increase by 22%, their visits to the emergency room decrease by 18%, Medicaid costs fall by 12%. There was a study in your backyard from Children's Health Watch in a group of pediatricians out of Boston that found that over the next 10 years, we will spend $111 billion in avoidable health care costs because of housing instability and housing insecurity.
And so one more time, just for the record, in your opinion, do you believe the current level of funding poses a risk to the public health of our children and families?
I do. Yes.
Thank you. And I yield back.